I have checked my patient's baseline and gathered and sanitized all my equipment. I have checked the door for any precautions or signs.
Come in.
Hello. My name is Felicia. I'm a student nurse at South Florida State College, and I'll be assisting in your care today. I'm just gonna go wash my hands before we start.
Okay.
Wash my hands. Okay, I'm gonna write my name. Can you see that okay? Okay. I'm gonna check the surroundings for any clutter or trash. I'm gonna make sure the bed is in the lowest position. Okay, upper side rails are up. Do you mind if I bump the bed? Okay. Can you give me your first and last name?
Brooke Phones.
And your date of birth?
11/21/97.
Do you have any allergies?
No.
How about to lay down?
No.
Okay. Okay, is there anything you need before we begin?
No.
Okay, I'm gonna raise the bed to a working height. No, I'm gonna move the table. Are you having any pain today?
Yes.
Okay, where is it located?
In my right wrist.
Alright. Okay, can you describe the pain for me?
It's like a dull ache.
And is it constant or does it come and go?
Pretty constant.
Is there anything that makes it better?
No, not really.
Is there anything that makes it worse?
Moving it too much.
And are you doing anything to treat the pain?
I've taken some Tylenol.
Okay, on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt, can you rate the pain?
4.
Would you like me to go get the nurse before we begin?
No, it's okay.
Okay. Have you had anything hot or cold to drink in the last 30 minutes?
No.
Okay, I'm going to have you place this under your tongue and close down, just don't bite. Okay. I'm going to use 7.6. And your apical pulse. I'm going to clean, warm, and go under the gown, mid-clavicular line, 4th or 5th intercostal space, and listen for 1 minute. Okay, 62. I'm going to count respirations for 1 minute. 17. And have you had any accidents to either one of your arms?
No.
Any breast surgery?
None.
Okay. Circulation. You don't have any noticeable dialysis points and no noticeable edema, and your IV is on the right side. So I'm going to do it on your left. Have you turn the hand into submission? Okay, for your oxygen. Clean, warm, and check your BP. Okay, 120/72. And oxygen was at 100. Okay, I'm gonna assess the IV. It is a 20 gauge in the right hand. And there is no noticeable, the dressing is clean, dry, and intact. There's no noticeable redness or edema. Do you have any pain?
No.
No. And the clamp is open for fluid infusing. I'm going to check the tubing for any kinks or air bubbles. The infusion rate is 75 milliliters per hour. I'm going to check the drip chamber is half full. I'm going to check that the fluid is clear, that she's receiving D5W, and there is 600 milliliters remaining. Expiration date is 09/2020, and I would notify the RN if it has been hanging for longer than 24 hours. I'm going to check oxygen, make sure the prongs are pointed down. I will check the cheeks and behind the ears for any redness or irritation. Okay. I will make sure that it's not too tight underneath. I will check the tubing to make sure there are no kinks and that she is receiving the proper amount of oxygen, 2 liters per minute. Okay, and then I would assess her fully. It is a 14th French attached to the left thigh. I would check the color and clarity of the urine in the tubing. And I would check how much urine is in the bag. There is 200 milliliters, and make sure it is attached to a non-movable side of the bed. And I would remove my gloves, wash my hands, put on new gloves. And it is a 14th French. Okay, Brooke, I'm gonna have you look at my nose. And do you know where you are?
South Florida State College,
Okay, and do you know what today's date is?
May 3rd, 2021.
Okay. Okay, I'm gonna look at my nose again. Direct. And can you pull your mask down and smile for me? Okay, can you open your mouth, take it, tell me to say ah? Okay, and have you had any issues swallowing today?
No.
No, okay. Okay, and I know your wrist hurts, but can you move your fingers? Color is normal for ethnicity. Can I check your so? Okay. I'm gonna check your pulse. And the temperature is cool and no noticeable edema. Okay, I'm gonna have you press up on my hands, okay, and push down, okay, and I'm gonna have you squeeze my fingers. I know your wrist hurts, okay, and are you having any numbness or tingling?
No.
Okay, can you move your ankles and your toes? Good. Color is normal for ethnicity. Check your cup. You feel okay? And posterior tibial pulse. And then pedal pulse. Okay. And can you press up on my hands? Okay. And push down. Stand with your feet. Can you push them towards you? And away. Perfect. And can I see your heels? And your other one. And heels are clean, dry, and intact. I'm going to remove my gloves, wash my hands, and put on new gloves. I really touched your feet, so heels. gonna check your skin turgor. Okay, and there is no telemetry monitor and a pulse rate was regular. I'm gonna assess the abdomen. And I'm checking for any distension or abnormalities and making sure the umbilicus is midline. I'm going to clean the stethoscope, warm it up, and auscultate for bowel sounds. 2, 3, 4. And then I will palpate, checking for any pain or tenderness, and watching for facial signs, any pain or tenderness in here. And when was your last bowel movement?
This morning.
Do you remember what color it was?
It was brown.
Do you remember its consistency?
Soft.
And about how much?
It was in a normal amount.
And when was the last time you passed gas?
This morning as well.
Okay. Patient is not using her accessory muscles, no shortness of breath or labored breathing. I'm going to listen to your breath sounds. I'm going to clean the stethoscope and move it under the gown, but I'm going to do it over. 1, 2, breathe in. Breathe in. And out. And out. Good. Okay, I'm going to have you sit up for me. Okay, in and out. In and out. In and out. And again. 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 Okay. And you said you did not have a cough?
No cough.
Do you have a cough? No. Okay. Run downward. Okay, sister, your wrist is hurting. I'm gonna have you turn to that side for me. I'm just gonna put this up. I just need to assess your skin on your back and your butt. Okay, back. And I'm checking for any redness or irritation or breakdown. Okay, you can come back. Okay, I'm gonna lower the bed down. Okay, the bed is in the lowest locked position. Upper side rails are up. I'm assessing the surroundings for any clutter. Okay. And here's your call bell. If you press this button, I or your nurse will be in to assist you. If not, we'll be rounding every hour to check on you. Do you want your table on this side even though your wrist is hurting?
Yeah, it's fine.
Okay. Okay. That is within reach. Take my step. Going to wipe down my equipment. Remove my gloves. And wash my hands. Is there anything else I can get for you before I go?
No.
Okay. Thank you for letting me assist in your care today. Would you like your door open or closed?
Close, please.
Thank you.